Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. I hope you're all having a good day wherever you are. I'm really excited, and I want to thank those of you who have contributed to the conversation. So I decided to post a video about that nurse from Atlanta who was so frustrated, so emotional, and decided to quit. And she quit live on Instagram, and a lot of people really went on, and it really brought a lot of viewers to my channel, and I was really appreciative of that. As some of you know, it's a new channel. I really started this to find a platform that I could put some information for students, and current events is something that I talk about the first 5 or 10 minutes of class, because I really think it's important that nursing students, nurses, and others in healthcare be mindful of what's in the public eye, what's on social media, what's in the news, and how it affects health, and how it informs your practice. It's really need to be aware of those stuff. And here we are. The coronavirus, current events, it's affected everything. It's affected how we socialize. Most clinical sites do not have students coming there. There are some that still allow nursing students to come. They're actually now asking for nursing students to come as volunteers. So it has affected your clinical. Most schools are now distance learning, online. My goodness, how has that altered so many people's perceptions? There have been those who had no value for it. Oh, online, they talk bad about stuff that they did not know, and here they are. They have to. Computers, technology, these application software, it's part of daily life. This coronavirus, this global pandemic, worldwide public health issue, it's affected so many people's lives. I feel bad for those seniors who are going to graduate, be it high school, college students, commencements. A lot of commencements are canceled. Regents, I just heard this morning, for those in the United States, Regents exams have postponed. So imagine those students have been studying and hoping to get a Regents diploma. What about the colleges that would normally accept a student based on those requirements? So the effects of this coronavirus issue, it's long-reaching. The deaths, individuals, it's not just old people that are dying from it, but for most, funerals. Social gathering also involves limiting the amount of people that get together. So imagine if you had plans for a big funeral to just express love, affection, gratitude, thank you for the individual who's passed on. They're gone, but grieving is part of many social norms, and they do it in a certain way. And this coronavirus is now impacting how individuals mourn, grieve, and say their last respects. And for that, I'm very sad for some people how you have to do that. Here's the good thing about this sadness, and we need to look and find better ways to do things. So we're now online, and it's now forcing a lot of people to learn how to do that. And I think that's great that we've learned. I mean, even Blackboard, a platform that's been around for such a long time. A lot of faculty never even went on it. Now it's forcing them to learn about it, and we're learning certain things, how to better give an exam and how to proctor an exam, because if students are taking this exam in their homes, what about the integrity? Do they cheat? And how much control do we have as an educator? So there's some things that we're learning about. Instagram, as you know, I'm on Instagram, and so join me there. The link is someplace up there. But I started this channel. For those of you who are new to my channel, I'm a registered nurse. This is I graduated nursing school in 1990. I was 5. So this July makes 30 years since I've been a nurse. So, wow, so when I talk about some of these stuff, it's not something that I learned yesterday or Google. I have done a lot of different stuff in the healthcare field. I worked on a med-surg/oncology floor. So death and dying and success, people fighting cancer and some winning the battle. Oh, I have seen that. I've seen people in their 20s die of breast cancer, and I've seen people as old as 90 recover. So I've seen a lot on the spectrum. I was in administration. I was a head nurse at one point, or clinical practice coordinator, as they call it. So I do under the management skills. I've worked in critical care. I've worked in discharge planning. I was a clinical specialist for stroke patients, so I worked as an educator in that role. I learned a lot through those different roles before I left the clinical site to become a full-time faculty in a college. So, you know, when I talk about some of these stuff, it's from my experience. I don't, you know, bash doctors and nurses who do. Shame on you. You know, this nonsense about, oh, you know, the doctor only spends 5 minutes with the patient and the nurse is there all day long. Well, explain why that is. You as an amazing nurse, you may have 8 patients. That doctor may have 30. 5 in the emergency room, 5 in ICU, 10 on your unit, and 10 in his or her office, sitting there in the waiting room, worrying, why is this doctor not here? I'm not into this bashing another fellow member of the health team. Talking bad about other people doesn't do anything for me. I'm not a politician. I'm not going to tell you who not to vote for. I am going to make every effort to demonstrate to you, either in my words, verbally, or in my actions, why you should vote for me. So as a registered nurse, it is my actions, my process, how I interact with another member of the health team, how I interact with my patients, including their families, how I advocate for them, how I talk to politicians and try to make them honest about the promises that they made with our money. That's what makes a good nurse, not talking bad about another person. And I say that to my students all the time. Don't think that you're going to gain any points with me by talking bad about doctors. You just tell me more about yourself. You know, for every bad doctor, I can show you 10 bad nurses, because the healthcare is a subset of society. There are bad people in society. There are bad people in the profession. There are bad people offline, and they bring that basura, garbage, trash online. So, you know, ladies and gentlemen, you know, so just be good to yourself. Be honest, be mindful. Give a good presentation of who you are. What comes out of your mouth, you know, just let it be, you know, let it illuminate just exactly what's in there. But so I'm titling this video about the CDC now recommending that people should wear some type of facial covering in public. I'm doing this in my car. I'm heading out. I'm in my driveway in my studio. A long time ago, I decided to name it after Harriet Tubman. Let me adjust the lighting in my studio. I just get a kick out of that. So anyway, so on a serious note, so the Centers for Disease Control now recommend that individuals should wear some type of facial covering when they're out. I find it funny. I see people with a mask on in their car. I mean, I'm safe in here. So facial coverings, of course, if you have an N95, and I do. So I have my N95, make my nice nose bridge, and the 2 straps. Important to put them on certain ways. So I'm not going to put them to mess up, just comb the hair. So, so if you have your N95, so N95, it filters 95% of most particulates. Okay, so when your patient, especially in the hospital, they're on precautions for airborne, an N95 mask. It doesn't have to look like this, but this is one type. So that's an N95 mask, and I do have one. This is mine. Every member in my family, in my house, have one. They're probably inside going, she's sitting in the driveway taping, but hey, that's one. Now, nurses do lots of things, and for a lot of you, I'm sure you did. I think you didn't even know that I can crochet. Yes, I can crochet. And you know, when I saw the videos, I'm like, all these people, they're putting up videos on crocheting a mask, face covering. I'm like, hey, I crochet. I've always crocheted. This mask, it's related to my field, health field, and protecting the whole world. I'm a part of the world. Why not put up a video? So I made a couple, and I'm going to, I'm not putting this on my face because I'm donating this to a local hospital near me. So I made something like this. Now just remember, this is crochet, so air gets through it. The purpose of the facial covering is really not to filter air, it's to block any type of droplet. So if a droplet were to come on this, don't then touch it and touch your face. When you get home, take it off, either put it in a in like a Ziploc plastic bag, and then wash it, and then you can reuse it. I would recommend that if you happen to go on that channel, go on that video and learn to crochet. I tried to make it pretty simple, and you know, I watched it, and sometimes I said I'm going slow, but I went a little fast. But the instructions are in the description in a Google document. I would recommend that you put something. I just took like a white handkerchief, and I cut a piece of this to make it fit in the back. So then this gives the face covering a little bit of a barrier, so any type of droplet doesn't come through that. So that's one. I've made one of that. And then I was having a little Pokemon kind of theme, so I made another one like that. And then made some pink coloring ones. And then some plain ones. So in my, you know, when I'm sitting, I can do 5 things at once. I can text and, you know, whatever. So the CDC recommends that facial covering. So I suggest that you try to find some way. If you can't crochet, don't worry. I got you. At the 99-cent store, the 99-cent store, these were $1.49. Why was it not 99 cents? I don't know, but I found a package that had 4 of these for $1.49 or 99. And I'm sure you've seen that video. So you just fold it in thirds. So fold it in thirds. Then you're going to take a scrunchie. So again, if you don't want to be fancy, just put it over your mouth. You know, you could breathe into it. Anything lands on that and you're good. As soon as you get home, take it off. Make sure you wash it and be safe. So do anything to minimize that. The reality is that some of us do have to go out. I'm actually going out today. I do some administrative work for an assisted living. And a lot of my interaction with them, I can do it by computer, online, but it's a vulnerable population, you know, so I'm heading by that facility today. You know, I have a routine when I get there. I don't wear my shoes inside. As a matter of fact, even though I have a key, I do not use the key. I ring the bell. I have a hand sanitizer. I don't touch the bell. I have a wipe with I sprayed with Lysol, so I ring the bell because other people go there, and I let the individual in the house open it. You know, there's an office that I use downstairs. I'll go down there. I'll work on the computer. I will look at the medication to see if the individuals have signed, because that's my oversight. The individuals there, they're not licensed individuals, but they're trained. They're called AMAP, approved medication administrative personnel, and we train them, and they get a training once a year. So that's another good thing for a potential nursing student to do. Ask around at a nursing home when this bid is over, or an assisted living. Are you looking for any AMAPs, or another term they call them DSP, direct service personnel? But the AMAPs, one of their roles is to give medications, and I check on them once a week. So I'm going to go in today and, you know, really wash my hands and make sure I have a different shirt. You know, I don't wear the same clothes inside, because once the residents see me, you know, I really have a good relationship with them. I bring snacks. I bring really good snacks for them. So I'm bringing some fruit snacks for them. And again, yeah, a little sugar is okay. You know, I know their medical stuff. I know what their allergies are. So even without any allergies, I try to avoid bringing anything with nuts. So listen, ladies and gentlemen, I want you to have a really, really good day. So for those of you new to my channel, thank you so much. Welcome. Please spread the word. You know how that works. I'm an educator, and I really created this channel again to find a way to give students some information, there are tons of YouTube videos, and I'll also recommend those. So please help me grow it. You know, with YouTube, you need a certain minimum to do stuff. So 1,000 subscribers I need, and 4,000 watch hours. And let me tell you, thankfully to that one video, the nurse who quits her job, it's gotten me so many views, and I'm so happy that I did that in about a week. It's almost 10,000. Yay, Cheryl. So, but I'm happy about that. And again, please, you know, send me some comments and just be respectful of each other. You know, even in the discussion, be respectful, follow Google's rules, and, you know, follow your human conscience, and just treat each other well. We can disagree on certain things, but just do it in a manner. There's certain things I respond to and certain things I don't. But anyway, so, you know, cover your face, you know, be good to yourself. And again, as always, If this is your first time to my channel, welcome. I hope you stay. Have a good day.